We do welcome you to our lunch forum with the title Federal Healthcare Reform, Competing Christian Perspectives, sponsored by a number of entities, including our Center for Theology and Public Life, the Office of Student Affairs. Claire Dyes, thank you so much for everything you've done to make this happen today. Where is Claire? Okay, thank you, Claire. This program is being offered under the umbrella of the Mercer Lyceum program, which is encouraging basically 2 years of reflection on the state of American democracy and kind of strengthening our sense of citizenship and public engagement, and also modeling a certain quality of conversation about difficult issues. And we hope to do that today as well. We've invited two very special speakers who have a deep stake on opposite sides of the healthcare reform bill that was passed in 2010, right? Wasn't it March 2010 when that finally passed? Yeah. So let me introduce them to you. Our first speaker today is Katie Paris, who serves as Senior Vice President of Media Matters for America, a media monitoring, research, and messaging center in Washington. Katie previously spent 5 years at Faith in Public Life, a progressive strategy center that builds coalitions of faith leaders around issues of justice and the common good, and also amplifies mainstream religious voices in the media. While in her role at Faith in Public Life, Katie was a key organizer of religious progressives and centrists in favor of healthcare reform or the Affordable Care Act. And I've gotten to know Katie over the last 5 years, and she's just dynamic and very well informed, very experienced. She's worked on Democratic presidential, senatorial, and gubernatorial campaigns. And as somebody who had a front row seat in the healthcare reform debate, she will bring a very knowledgeable perspective, as will Josh Trent. Josh Trent serves as a healthcare policy advisor for Senator Coburn of Oklahoma, Republican. Previously, Josh served as the Deputy Director of the Refugee Resettlement Office at the Department of Health and Human Services. He served in the George W. Bush White House in the Office of Presidential Personnel. He worked for the Chief of Staff at the Labor Department. Josh, as healthcare policy advisor to Senator Coburn, was also right in the middle of the healthcare reform debate on the opposing side. And so I asked our guests today, both of whom are committed Christians, both of whom are very thoughtful people, very well informed, who ended up on opposite sides of one of the most significant policy debates of the last 4 years. I asked them basically to tell us how they got where they got, to explain their different postures on healthcare reform, and to try to relate the positions that they ended up with to their faith and their values. I did this, we've made this introduction or this invitation not to create some kind of cage match, kind of death match argument over healthcare reform. Talk radio and cable TV gives us plenty of that. We're not doing that today. I genuinely want to understand, and I want us genuinely to want to understand how people of goodwill, of shared faith, and many shared values could end up on opposite sides of key issues, because that is our culture. That is our nation, and that is where we are right now. And the way we often deal with our differences is to demonize one another. And that's not what we're going to do here. We're going to have a conversation that I hope will bring a lot of illumination. We want to demonstrate that civil, intelligent dialogue is possible across party lines. In fact, it's imperative. It doesn't always lead to consensus. I don't think one or the other of our speakers would be able to say, oh, I was wrong about healthcare reform. I don't think so, really. But as we come to talk with each other and understand each other, we learn how to live together in community. And so that's what we're working for today. So our program will go this way. Katie will go first. She'll have about 15 minutes. Josh will go next. He'll have about 15 minutes. And then we'll open it up for civilized questions from the audience, okay? Questions, not statements. So, Katie, you are up first. Welcome, Katie Paris.
Thank you, David. And thanks to the whole community for welcoming us here today. This is so cool. I mean, this just doesn't happen every day. My 30th birthday came and went during the summer of the healthcare debate, and I remember thinking, wow, lucky me, not a single ache and pain, but this healthcare debate is beginning to make me feel old. It had gone on for months, which I'm sure Josh felt more than most kids in Washington too. Josh, I think you and I were 14 when President Bill Clinton joined a lineage of Democratic and Republican presidents stretching from Roosevelt to Nixon who tried and failed to fix our broken healthcare system. At chapel this morning, I talked about how I feel compelled to address the things that frustrate me and how that has everything to do with my faith. The way I see it, I can't worship God or call myself a Christian and ignore Jesus' example in my work and in my life. I can't only bring my faith to bear in my friendships, my marriage, my personal decisions, though those things are so sacred. I have to bring them to bear in my thinking as an American and as a citizen of the world. That means my faith has to matter when I think about things, about like how I take care of my family, but it also means I need to think about my faith and how I think about how we make sure everyone else can get the care they need to. So I fought for the healthcare reform bill because I was frustrated that our leaders had tried to fix our healthcare system for 70 years, but had not yet succeeded. And I was even more frustrated that this was true in the face of the fact that 45 million Americans lack health insurance, and 22,000 Americans die prematurely every year because of that fact. Meanwhile, average Americans were struggling to pay their health care bills, many driven to bankruptcy. Small businesses were burdened beyond their limits, all while health insurance companies raked in massive profits. Americans were losing control of their health care, parents losing control of the simple ability to decide when they needed to take their kid to the doctor. The insurance companies were in charge instead of our families. But I knew we needed healthcare reform not just from reading statistics, but from working with pastors who saw the consequences of our broken healthcare system in their own congregations. My friend John Hay Jr. was a senior pastor of a church in Indianapolis that is 2 blocks from 2 hospitals. He saw a lot. His stories of families who put off needed medical care for their children because they couldn't afford to see a doctor, only to be forced to rush them to the ER when problems reached chronic stages, were the definition of brokenness and injustice. I fought for the health care bill because this kind of suffering and financial hardship is entirely preventable. All of us, no matter what our political or religious convictions are, know that the status quo on this one isn't acceptable. We all know that we can do better as people of faith, as churches, as communities, and as a country. For too many years, special interests and big insurance companies have spent millions of dollars to convince us of just the opposite. That either there are no problems to be solved or that they and their political allies are not the ones responsible. And for too long, they did succeed in scaring many Americans and politicians into inaction. As long as our seniors must choose between paying for their medicine and their food, we as a country are not affirming the dignity of their lives and their choices. As long as children go without care and treatment because their parents cannot find the money to pay, we are not holding their lives as sacred. The lives of all Americans, all God's children, should be held as sacred, not just to those who can pay for their insurance premiums. For this reason, health care is where we should have moral questions. And I think as people of faith, we should contemplate what our role and what the role of government should be in not only improving health care, but helping people live healthy and abundant lives as God intended. The Bible doesn't provide specific public policy for prescriptions for how to solve our health care crisis. Anybody who says it does, well, don't trust him. Christians can disagree on many details of healthcare reform, but Scripture does make clear that health and healing are both personal and communal responsibilities. The biblical health codes that governed the Hebrew people ensured that no one was left out because of cost. Jesus never turned away from human brokenness, but responded to it by healing both rich and poor alike. The very first followers of Christ lived out a responsibility to care for all, as anyone might have need. From a Christian perspective, when our present reality does not match the ideals lived and expressed by Jesus and the prophets, neutrality is not an option. So what do? Many of us agree that we must solve our healthcare crisis, but have significant differences when it comes to how best to do it. And the role of government is a question that is raised time and time again in this conversation, and it should be. When we're faced with an enormous problem in which the lives and livelihoods of Americans are at stake, no individual or community can solve it alone. This is an issue that calls all Americans to come to the table, find solutions together. I'm not willing to say that there are any resources that shouldn't be brought to bear when it comes to solving our toughest problems. That includes families, churches, communities, businesses, and government. Government is not the first solution to every social problem. There's a principle in Catholic social teaching that can serve as a guide. It's called subsidiarity. It simply means that issues should be addressed first by the competent authority closest to the problem, family, church, community. But the same Catholic teaching says that achieving the common good in the face of our greatest problems requires government involvement. Government plays an essential role, and I think that we often fail to recognize that in our day-to-day lives. So Texas Governor Rick Perry, have you guys heard of him? A leading Republican presidential candidate, and other opponents of healthcare reform, they've made the argument that healthcare reform attempts to replace the charitable role of the church. For them, charity and justice are mutually exclusive. They imply that making sure all Americans have the healthcare they need counters the work of churches and faith communities. Perry and his allies say that Christ's command for love was meant for individual Christians, not government. And so we should cut things like healthcare because Christ told Christians to care for the poor, and the church can care for the poor much better than government. I agree that our churches are great at caring for the poor, and the government can be inefficient. But the reality is that it doesn't matter whether the church could do a better job. The church isn't doing it. We wouldn't need Section 8 housing if we had enough Habitat homes. We wouldn't need food stamps or school lunches if we had enough soup kitchens. We must honor the unique roles that different parts of our society play as we try to live out our values, the church, the government, and charitable organizations alike. We can't tackle our biggest problems without all of them, or any of them on their own. Christ's teachings were meant not only for individual Christians, but for all of our institutions that make up the fabric of our society. Our governments, our budgets, our policies, our politics, all of it. They should all reflect our values, just as our churches and local organizations and families should too. We are all called by Jesus and the words of the prophets to take up healthcare as both a pastoral issue of charity and as an issue of justice. There is no doubt in my mind that the radical love Jesus commanded of us also commanded justice. And the justice proclaimed by the prophets commanded love and compassion. We are called to minister directly to those in need while also working for a more just society. So the new healthcare reform law, which is now a year old, is a significant step in the right direction. It is not perfect, but I think it very much reflects the values that I just discussed. One thing people forget is that the law applies many of the best ideas for extending healthcare access and controlling costs that have been brought forward by Democrats, Republicans, and independents alike. Crazy things happen when politics get involved. It is truly a representation of what we can do when we bring everyone to the table to fix a tough systemic problem. It wasn't an ideological, politically driven scheme to put government in charge. And guess what? As the law now is being implemented, more and more Americans are getting what they need. The law protects people from insurance companies, holds them accountable. It makes sure that they spend more money on your health care instead of jacking up costs to line their own pockets. The law ends the worst insurance company abuses, like denying you or your child coverage because of a pre-existing condition, dropping you when you get sick, and limiting the amount of coverage you can receive in a year or in a lifetime. That will be no more. For seniors, the law cracks down on waste, fraud, and abuse in Medicare, which will lower premiums for seniors and guarantee Medicare benefits longer into the future. For young people, it allows them to stay on their parents' insurance policies until they're 26 and offers critical preventive services to help them stay healthy. The law also makes healthcare more affordable for small businesses. It lets them band together so they can get the same rates on insurance as bigger corporations and offers tax credits for providing coverage for their employees. This means they can spend less money on premiums and more on growing their businesses and creating jobs. In the end, costs will be reduced for all of us. Most of this stuff hasn't even started to be implemented. Individuals will see their premiums drop by more than half, and families will save about 25% compared to what they would have paid without the law, because we saw how those costs were just going up and up. Most importantly, we'll have healthier kids, families, and seniors. By making sure all Americans are covered and no one is left out, which in part requires everyone to take responsibility, the law is all about giving American families more control over their lives and choices, which has too often been in the hands of those insurance companies. In the fight for the health care bill, people of faith, evangelicals, other Christians, nuns, other Catholics, Catholic health providers, leaders of other faith communities, they seized their unique position to be a uniting force, while also being the force that challenged and agitated for progress. They held both sides accountable. They made sure the abortion debate did not derail health care, although it came close. Faith communities fought for health care for years in our country. With passage of the health care bill, our leaders actually, finally, listened. Josh.
Good afternoon. Pleasure to be with you. Thank you, Dr. Gushee, for the opportunity to be here. Thank you to the faculty and staff for your attendance and presence, and for all of you who made this event possible. So this is going to be a great discussion. I look forward to it. Let me just step back and say, it's there's been a ton of discussion about health reform this past year and the year before that and the year before that. And today you have the opportunity to hear from both of us as evangelical Christians. I just want to tell you that I'm going to share my perspective as a Protestant evangelical who believes the historic tenets of the Christian faith, adheres to the Apostles' Creed. I completely respect and appreciate if you're coming from a different position, whether that's a different philosophy or a political party or a different religion. But I hope that we can be respectful of each other's thoughts and opinions and have a good discussion. So we talk a lot about health care. Why do we need health care? I think that's an important question to start with. And I think Christians would answer that theologically. I think Christians would answer the need for health care with the fall. Because Christianity teaches that there's a good God who created the earth, and that mankind was put in charge of creation to be a steward of it, and that humankind rebelled and turned away from God in disobedience. And because God is good, He has to punish men, but because He is loving and merciful, He's provided a way of escape from His judgment through the person and work of Jesus, so that anyone who repents and believes in Jesus has eternal life. That's kind of the nugget of Christianity. But the important thing to understand is that Christians understand the fall to be real and have impacted everything. So Christianity teaches that man dies and man gets sick and man needs health care, humankind, I say man, meaning mankind, men and women, because of the fall. So that means that everyone, at some point in their life, will need some degree of health care. And that's an important thing, because Christians also understand men and women here to be made in the image of God. And that's a profoundly sacred and important reality. So it's not a light thing to say what Christians think about health care or about what should be offered to individuals. That's a very important thing. I think practically it's clear we all need health care, just like we need food and water and shelter. It's part of having kind of the basic necessities to sustain life, and having some repair of injuries, medicinal healing of our of our sicknesses, even delaying death. That is part of what healthcare is. But I think it's important to also kind of take the term healthcare and chew on it just a minute. What do we mean by healthcare? For us, a lot of us today, it means an insurance policy. But for Christians, particularly hundreds of years ago, or even tens of years ago, they wouldn't necessarily have thought about it as an insurance policy. The tax treatment of healthcare is ensconced in our tax code. That's only about 60 years old, since World War II. So you ask someone, a Christian 100 years ago, what do you think is, how do you think about healthcare and what's kind of basically needs to be made available to people? They have a very different response. Go back a little further and go back a few centuries, and the whole idea of healthcare would look very different because of what we know about modern medicine now and the advances we've made in medical science. So I think it's important when we think about healthcare just to kind of define what we're talking about. I agree with Katie. There's no universal, monolithic Christian teaching on healthcare. We both come to our passion about healthcare as Christians, but there's no one Christian way to look at it. The Bible doesn't offer a specific policy prescription. So you can ask Christians what they think about Jesus, what they think about the Bible, and there are some core convictions that they hold in common. But as soon as you go from those primary theological issues to secondary issues that certainly the gospel has implications on, but that would be secondary issues outside of the kind of theological core, there is a lot of variety. And I think that's healthy, and I think that's fine. I think it looks very different for Christians a few hundred years ago, or Christians, I used to live in the UK. Christians there thought very differently about healthcare than a lot of Christians do here. And I think that's fine. It's contextual, based on where we are, based on what medical care is available, based on what time we live, and how far medical science has advanced. So I want to be careful. I care passionately about healthcare, but I want to be theologically careful as a Christian to not universalize my experience and say that because I feel this way about healthcare and this way about Christian teaching, that means that all Christians everywhere should do X, or that all Christians everywhere should have X kind of healthcare. Just want to be careful in that. And I completely appreciate if you have a different approach, but I just want to share that with you. You're going to have to wave at me when my 15 minutes is close because I forgot to look at my watch. But I have just a couple more thoughts I want to share with you. I care deeply about healthcare. My brother is an emergency physician. He's an ER doctor. My uncle is an orthopedic surgeon. My brother's wife is a pharmacist. My aunt is a physical therapist. And I'm a user of healthcare. So I want it to be good. I think there are a few things that impact people in a more personal way, that are more visceral. I think that's one reason that the debate was so heated at times, is people feel passionately about healthcare. And I want to build a system in America that is fair and that is just and that works for every patient every time. I think we need health reform. I agree with Katie on what a lot of the problems are with respect to insurance companies. I think costs are too high. I think access is too limited. I think quality is too spotty. And I think you don't have enough choices and control over your own health insurance. We live in an iPad, iPod world where you can make all sorts of choices as a consumer. And the fact that you're only locked into a few choices in your health insurance, I think means the market's not always working for everyone every time. And we need to make a fair and competitive system. So I agree with her on that. I think my basic contention with respect to the Affordable Care Act is that I don't think it fixed the problems in our healthcare system. I worked with my boss to offer a comprehensive alternative that would provide care for just as many people. But I think I just kind of want to walk through a few things. I think we call it health reform, but I think you have to look at what the problems are in healthcare and then really ask intellectually honest questions about, did the bill fix those problems? Let's just take the issue. I think basically most of you probably care about cost. I think cost is the access issue. There are 45 million Americans that are uninsured. That number has gone up since the passage of the Affordable Care Act because the economy's down. So there's 50 million Americans without health insurance. Roughly only 16 million Americans make $25,000 or less and are uninsured. I think those are the people we should really be targeting, people who can't afford a health insurance policy. And instead of fixing what's broken and building on what's working, I think we've taken what's working and it's less strong, and we have made some of our problems worse. So in cost, it's not accurate to say that premiums will be cheaper for families, for all families, because the Congressional Budget Office has said it will be $2,100 higher for millions of Americans. There's $813 billion in new taxes. Now, there's nothing wrong with paying taxes. We all pay taxes, and frankly, we talked about it in chapel, Paul commanded Christians to pay their taxes. But there's taxes on health insurance, on pharmaceutical drugs, and on medical devices. I don't think that's the direction we want to go for cost. National health expenditures. We all agree we spend too much money on health care as a country, and we get bad outcomes. Thomson Reuters, health analytics firm, says that $1 in $3 in health care is wasted. Doesn't keep anybody from getting sick, doesn't help anybody get well. It's true, there's a lot of inefficiency in health care. And what are we doing? National health expenditures will increase 80% by 2020. The bill itself costs $2.6 trillion over 10 years. You all have looked at the state of our country right now. $2.6 trillion is a lot. We're running a $1.4 trillion deficit this year alone. Now, the reality is we can have affordable, high-quality health care for every American. And we can do it as a country. We're a rich country, and we can't afford it. My contention is not that we shouldn't do it, or not that we shouldn't have it, but that we're not fixing the problems that are there. The bill looked like it would reduce the deficit for mainly two reasons. You have a 10-year budget window that the Congressional Budget Office evaluates the bill. It has only 6 years of spending included in that bill. It also has a long-term care program. There's an article in the Wall Street Journal today. It's called the Class Act. And it's basically this idea that you can pay into a long-term care program for a few dollars, and after 5 years you're fully vested and you can get a lifetime of benefits. Well, the Congressional Budget Office and the actuary of the Medicare program and the American Academy of Actuaries all say that this is long-term going to go belly up, and that we'll either need a bailout or that will leave those people that are in the program with a need for care. Let's talk about access for people made in the image of God. If we care about giving them access to affordable health care, 8 in 10 Americans currently that have health insurance like the health insurance they have. The Congressional Budget Office has said that 9 million people will lose the health insurance they have. So the Affordable Care Act expands health insurance to 30 million Americans. Interestingly, at the end of the 10-year budget window, there are still 30 million Americans without health insurance. So it doesn't provide universal coverage. And of the 30 that it does cover, the actuary of the Medicare program has said that up to 25 million Americans may be put into Medicaid. Now, Medicaid is not a perfect program. It's funded in part by federal taxes and in part by state taxes. You as taxpayers are paying for all of it because you're paying for there's only one set of taxpayers and it's all of us. And so you're paying for it. Medicaid needs reform severely. Right now, 40% of physicians don't accept Medicaid patients because reimbursements are so low. And in California, up to 70% of specialists won't take Medicaid patients. So that means that anyone on Medicaid usually has poorer outcomes. There's a range of clinical studies now that has shown that people have higher rates of infant mortality on Medicaid. They have higher complications after major surgery, and they have higher death rates. And I don't think we should force millions of Americans into a broken system. I think we should fix the problems rather than just expand that broken entitlement. 1 in 10 physicians, we surveyed physicians nationally. 150,000 physicians. Of the people that responded to the survey, 1 in 10 physicians said to pass the bills. 2/3 of physicians said, start over. You're not fixing what's broken in our system. You know, Katie talked about the issue of seniors having to choose between the Medicare and their food. 7.4 million seniors will be kicked off of Medicare Advantage, the private plans that they have, that they enjoy. And we didn't fix, did you all realize this? Medicare, for all we spend on it, it doesn't even provide maximum out-of-pocket coverage for seniors. So seniors do lose their home or they do lose their car because they have unpredictable Medicare bills. We didn't fix that. There's a part of Medicare that pays doctors to see the seniors. It's known as the sustainable growth rate. The problem is it's not at all sustainable, and every year Congress has to come in and patch it. That wasn't even included. That was a $300 billion price tag for that piece. That wasn't even included in the bill because it would increase the cost of the bill. And so this year we have to figure out how to prevent physicians from getting a 30% pay cut at the end of the year because we didn't fix the SGR. So I'll stop here. There's a lot more to say, but I want to kind of get into Q&A and discussion. My just kind of central premise is we need health reform. I want health reform. I want to work for health reform that works for every American. I just don't believe the bills fix the problem.
Okay, so maybe I'll start off. Here's your water. I'll start off by letting you either ask each other one question or respond to something that another person has said. We'll just do that one round, and then we'll go into questions at the mic. Yeah. Josh, you want to go first, or Katie?
Why don't you go first?
Sure. I mean, I guess I would just say that in general, my response to Josh's is, man, I wish this is the space where our political leaders could have these conversations. You know, in terms of that, okay, let's all agree. We need to fix this system. We do need health reform. That is not where the conversation was during most of the healthcare debate. Far, far from it. You know, I talked a lot about the role of government because that is where most of our debates these days come down to. You know, all the leading Republican presidential candidates are really making an argument for a lot less government involvement in most things. And that's where the debate is, and it's, you know, whether or not we should get involved or not. If we could have a conversation where we agree, okay, we've got this moral obligation to tackle this thing, it's broken, we got to fix it, and could then have, you know, a fact-driven intellectual discussion about how to do it best, that would be a blessing for our country.
Yeah, I just want to say I'm passionate about this, and so I hope that when I'm passionate, it doesn't come off as overly harsh. I certainly don't mean for it to be. I think too often in Washington we lose the tone of being respectful and thoughtful and you know, really having a debate on the merit of the debate rather than trying to kind of disagree on someone's motives. So I agree with Katie. I think if we could have a fact-based discussion in Washington, which you actually help advance through your work, then we'd be better off. But maybe we should kick it open for
Sure.
Well, I have to ask you, Josh. I'm breaking my own rule. So, does your senator support just the total repeal of the Affordable Care Act or some part of it? Or what is the status on that?
Right. So,
or you personally?
Right.
However you want to answer that.
Maybe it's easiest to talk about me personally. What I really want to do is I want to fix the problems that are broken. And I think the law was basically $530 billion of cuts to Medicare and $560 billion of tax increases. And half of the people who have the coverage, like the coverage they have, they'll lose it by 2013. And that's HHS's own numbers. So I think we're in a unusually perilous economic time. And it massively expands Medicaid, which is about $118 billion price tag on the states. The National Governors Association has already said states are in the worst fiscal crisis since the Great Depression. And so with those new mandates and controls, those costs, I think, are pretty unsustainable. I think because it increases our federal commitment to health care spending and increases costs for individuals, I think it should be repealed, but I don't think that that means that we don't need health reform. And I think that's a distinction that's sometimes lost.
Okay, start over.
Yeah.
Okay. So could you go to the microphone so everybody can hear? We also are recording this, so if you're irresponsible, everyone will know from now on. So civility and intelligence and brevity are called for. Yes, Felicia.
Josh, you did mention universal health care, and you said you had an alternative plan. And I'm trying to understand where you fall on the universal health care thing. And do you agree that we need universal health care?
Yeah, I do. I think, to Katie's point, part of the problem...
You are a radical Republican, Josh. I like it.
I want to fix the problems. I talk with my family that are, healthcare providers and talk with a lot of physicians, and you see what doesn't work in the system. And it doesn't work for people. We're the United States of America. We have policy solutions. We should have the moral courage and the political will to fix our problems. So I think too often people don't have the choice of insurance plans. There have been abuses by insurance companies. But there's a lot to be said. I don't want to wander from your question, but the answer is yes.
So you see some hope of universal health care passing?
I think it depends. I'm not trying to play semantics, but I think it depends what you mean by universal health care. I think we can make a more competitive marketplace. Well, I think every American should be able to have a health insurance policy that's affordable. And I think when you use choice and competition to drive down cost in a market, and you have people competing on cost, quality, and outcomes in a transparent marketplace, people are smart enough to make their own decision. Now, for people who really need help, we should absolutely make sure that they get the care that they need. But I think there are problems with the kind of the idea of the federal regulation of health insurance because it takes over local markets, and it doesn't. Some of the things like the idea that federally mandated medical loss ratios, that you can spend 80 to 85% of every healthcare dollar on benefits for the individual. That sounds really good. But that actually prevents health insurance companies from doing anything with regard to waste, fraud, and abuse. So there are just kind of unintended consequences. We agree on what the problems are. I think it's just a matter of differing on sometimes what the policy solutions are that actually fix those problems.
Yeah, I mean, I just think we need government to be involved. And if that means the big bad R word of regulation to get our insurance companies in line, I'm okay with that. But amen to most of what Josh said. Again, if we can have a debate about how to get everyone covered, because that's the American value here, and I think that's the faith value. I mean, I believe we're all in this together. I believe that my neighbor makes me stronger, not weaker. And ultimately, let's continue this conversation and have it here. And I think that to hear Josh say that he wants us to have universal health care is like this breeze of fresh air just blowing right across my face. So, because, it's not where most of the rhetoric is in Washington.
All right, next question.
I had a question. Why did it take so long for the Republican Party to want to do something to change the system that we're looking at today that seems as if it's broken in some spots to kind of create this universal health care policy? And what are some ways they're trying to make it better?
So is that primarily for Josh then?
Yes, it's for Josh.
All right.
I'd be interested in your thoughts on this too. I think Republicans, as a party, we failed in healthcare in a lot of ways. There's some good incremental things around the edges, but there's a lot that we didn't do to fix the problems. There is an important philosophical difference that we should just kind of note, which I don't want to overly emphasize, but there's a difference in approach that would emphasize whether regulation is done at a state and local level or whether it's done at a federal level. And that's an important and legitimate philosophical difference. So, that's just important to note. I think we didn't get a lot right. Medicare Part D is a good example. It's the drug prescription benefit in Medicare. It's a good example of how a private plan can provide a benefit for seniors. It's voluntary for seniors to enroll. 9 out of 10 seniors have a private drug plan. And the cost, because of generic utilization and choice and competition between the drug plans, we really made them hold them accountable. It came in 40% less than we thought it would. The challenge was, how was it paid for? And it wasn't really financed in a permanent way. The crisis we have before us is really one of Medicare and Medicaid. Medicare and Medicaid cost 1 out of every $5 that we spend as a nation, and they grow at about 7% a year. And as we're going to add 15 million new baby boomers into Medicare over the next 10 years, and potentially 18 to 25 million people onto Medicaid. So it's really an issue of cost and cost constraints. Medicare and Medicaid lose about $100 billion of waste, fraud, and abuse each year, which is roughly just a little bit more than the annual cost of the wars in Iraq and Afghanistan. So we have to get serious about some reforms that actually fix the problems. The actuary of the Medicare program has said that the program could be bankrupt as soon as 2016. And in my view, if we really care about seniors who are on the Medicare program or people who will be on the Medicare program, we have to have the political will to fix the problem so we never get there.
So I was just going to say that, Republicans have tried to solve this problem too. We've had a 70-year history of, different presidents, including President Nixon and others, who did try to fix our broken healthcare system, try to get universal healthcare coverage. So I just think that's important, and I want to note this is a bipartisan fight, and that was part of what was so, in part, frustrating to me coming into this debate, and it created the real urgency of, wow, we actually have an opportunity here. We better make the most of it. And I guess I would just respond to the piece. I think sometimes we create these dichotomies between Democrats and Republicans, progressives and conservatives about, well, one is for states' rights and one is for federal rights, and that progressives and Democrats, they just want the government to do everything. I tried to make clear in my remarks, I think that if the states got it covered, great. If the families got it covered, why are you going to get government involved? If our churches or charitable organizations have it covered, don't get the government involved. Same thing with states, but I think sometimes, probably the most historic example is the Civil Rights Act. Sometimes the federal government really needs to be involved. And there are a lot of things in our lives that I think that we sort of fail to notice in terms of the role of government in our lives. And is it always efficient to provide health care for handicapped children? Profitable? Maybe not. Is it profitable necessarily to do all the road maintenance necessary so that you and I can drive safely to work and our businesses can prosper by bringing their goods to market? Our government paid for those roads. And by our government, I mean you and me.
All right, another question. Yeah.
I'm a second-year pharmacy student, and I would like to ask my question in an example. We had a patient that brought to us a health care bill. There was an intended charge, doctor, facility, and drug. The drug, they were asking $150. The insurance statement came in. We found that the insurance company had paid $1.50, and their question to us was it undercut? Well, we referenced the drug company charged $15 for the vial. The actual cost of the medication was 87 cents. So the $1.50 actually covered the drug and even the syringe to administer it. And we called the doctor's office and we asked why the charge. And they said, well, there's a doctor's charge, but a nurse gives that. And we have a lot of soft charges. Well, I found it upsetting that the doctor's office wanted to charge 100 times the cost of the medication to their uninsured patient, whereas the insurance company, often demonized, negotiated for almost twice the cost of what it actually was. So my question is, how does this health care legislation go towards helping identify what the true costs of health care are and to keeping, because an insurance plan that's going to pay 50% of asking would still be paying 50 times the cost of the drug out of taxpayer money, as opposed to, as long as the cost is covered. Does this health care legislation go towards helping delineate what those true costs are and maybe subsidize some of those costs so that we're actually paying for the health care we're receiving?
Right. Yeah. What a tremendous story, and how frustrating, right? that's how it would work. So the healthcare bill does include a lot of elements to it where the idea is to be able to share information and create much greater efficiencies and accountability. Ultimately, how will it work in that individual situation? Honestly, I want to do a research project and get right back at you, because these questions are super important. You may actually know more information on an individual instance like that. I do believe that we have to continue to work for much more accountability when it comes to drug prices. There's been a fight for a long time in this country about, a lot of people go to Canada and get their drugs from other countries because they're getting ripped off here. And we need to allow that competition to happen so people don't have to get on a bus to go to Canada to get drugs that they can afford just so that they can live.
I agree.
You want to say more?
Yeah.
I would like to say I'm aware that some people need to go to class, but we want to get some more questions in, so if you have to leave, just be as quiet as you can and we'll keep going. So who's got the next question?
Good afternoon. My question is for Katie. I had a little bit of trouble understanding the correlation between there not being enough soup kitchens versus people receiving food stamps. And the confusion for me is I understood food stamps to be something that was a benefit from the government for people that were under a certain income level, and soup kitchens are primarily the initiatives of faith-based organizations, nonprofits, and things of that nature. So what is the direct correlation that you were talking about?
Yeah, sorry that wasn't clear enough. Basically, my point is that it gets back to what I was saying before. If our families have an issue covered, have a problem covered, government doesn't need to get involved. If our churches have an issue covered, charitable organizations, government does not need to get involved. But when we have these issues like the need for food stamps, the need for free school lunches, because there are families out there that can't afford these things. If our churches were able to provide enough soup kitchens, if they could be making the free lunches, to pick up on your way to school, if our churches and our communities and our charitable organizations could provide for the tremendous need that exists, we wouldn't need to have government as involved in our healthcare. But the reality is that our churches fall short.
But don't the food stamp benefits give families the opportunity to supply the needs for themselves versus going to get a prepared meal?
Oh, sure, absolutely.
That's the trade-off I'm really considering, to have a prepared meal every day versus being able to go out and buy your own groceries to prepare that meal.
Totally. I agree with you. I mean, my point is a symbolic one, to tell you the truth. Again, so I'll just make the direct comparison. If our churches could raise the funds privately within their congregations and then take care of everyone in the community and give them food stamps, then government wouldn't need to be involved. Does that make sense? The point is that there is a gap between the great, huge, tremendous need out there and what gets provided based on individuals stepping up to the plate in beautiful, wonderful ways in churches every day, heroically serving their communities. But there's a gap and it falls short. Does that make sense?
You mentioned earlier the cost of health care, and I was more concerned about that. You also mentioned that it was 45, if I'm correct, 45 million persons in America who are uninsured. Would you say that are you saying the way to address that issue is based on cost, or are there other solutions to solve that epidemic or problem in America?
That's a great question. I'm saying that for most people, not everyone, but for most people, most of those 45 million Americans, cost is the main problem. And what we have done under this Reform Act, if you want to call it reform, is we've increased costs and we've shifted costs. And the government has intervened further at a federal level. I'm not against regulation. I'm not against government. I work for the federal government. I think we need a good federal government that is responsive and active and does what it should do well. I think the problem with costs is that there is a lot of good data that is nonpartisan and objective that shows that Medicare's role in commercial markets is one of price fixing. It decides how much something costs and how much it's going to pay a doctor for a certain time. And I liked a lot of what President Obama said in the early part of 2009, talking about how we need to get Medicare away from just paying for volume and really get to value. That's where we need to go in healthcare. And I think one of my central frustrations is we didn't actually fix that. And because Medicare as a program covers about 45 to 60 million Americans, it has a huge impact on the commercial market. And commercial health insurance plans often benchmark to Medicare. So that there are disincentives and distortions in the market there that aren't addressed. The specific issue with cost, part of the problem is the way that we treat employer-sponsored health insurance. That came about from World War II. It's part of our tax code, and that's good that we have it. It works well for an employer-based system. But why in the United States of America today, when you lose your job, should you lose your health insurance? It shouldn't be that way. You should have portable health insurance that you can take with you wherever you go, because it creates, for too many of you, I've experienced it, job lock, where you feel locked into a job because that provides you health coverage. What really drives up health insurance premiums is medical trend. It's the cost of providing services. So until you get the overutilization in the system and the cost of providing services, it's hard for the whole pool of people that are insured that kind of all chip in together. That's the way insurance works. It's hard for that to decrease. It just continues to increase. You know, it's interesting. In 1970, in national health expenditures, what we all pay, 1 in $10 was paid out of pocket. Excuse me, it was 1 in $3. 1 in $3. So there was a lot of out-of-pocket expense. And because of that, the health insurance policies were cheaper. Today, in 2018, it's 1 in $10 is out of pocket. Now, we all like not to pay less out of pocket, but the problem with regard to cost is that we use health insurance more like prepaid medical benefits. If you were to compare it to auto insurance, we use auto insurance when we have a major damage or engine repair or collision, but we don't use it to change our oil and to change our windshield wipers and to balance the tires. But too often in health insurance, because there's a third-party payer and we're not always aware of the cost in the system, we think, hey, I have a $20 copay, I'm paying, so our out-of-pocket costs decrease and the cost of the overall health policy increase. And so what I'm saying is what you can do with competitive markets to have better choices based on cost, quality, and outcomes. People can see, they compare different plans, they can get what they need, and then that's one reason HSAs are growing so much, is that people can choose to have a high deductible plan and pay a little bit out of pocket and save for that, but then meanwhile have a low premium. And those are things that we can do. I totally agree with Katie. There are some things we need to do for insurance companies to have more transparency and cost. But anyway, that's enough on that problem.
One more question. Maybe time for two.
Good afternoon. My question is, I guess the gist of my question is, how is the policy analysis of this bill done, or even the changes that want to make? I've taken a few policy analysis classes, and just thinking about a matrix of some sort that says, if we change this about this policy, this affects these people in this way, and if it's negative or if it's whatever the effect is, and we're okay and we can stand behind it. Because what I think is happening is we're making these changes and we're affecting these people in this way, but nobody wants to say, oh, we're sorry, but we just took away your health care. We're sorry that we ran up your bills. So we want to, the matrix to me is just not clear. And I guess sort of how is this policy analysis around health care, how's that conversation really happening? You know, we get the media part, but how's it really happening when the rubber meets the road?
That's a great question. I think there's a ton of analysis, and what's hard sometimes is to know whether that analysis is valid and what are the assumptions going into that analysis. So we have a scorekeeper in Washington called the Congressional Budget Office, and they make kind of tell us how much a bill is going to cost and what's the coverage impact. Well, they basically have said, they're never actually right. They kind of know there's a range of outcomes, and they try and pick the middle one so that they're either half wrong or half right. They have a better chance of being right or wrong, kind of equal offender. So you get some people who will model more generous assumptions, some people who will model different assumptions. It is hard to know what the data, where it kind of shakes out. I would just say look at nonpartisan independent research. People are kind of on both sides, like picking their favorite studies and picking their favorite assumptions. But the reality is folks on both sides of the aisle misuse facts sometimes or add their own spin. And it's hard, but it's important to be informed on what the differences are.
Yeah, I totally agree on using, how important those independent sources are. I also think historical precedent, what has worked and what hasn't worked in the past, is incredibly important, because what Josh said is true in terms of the CBO scorecards of what happens with these bills. I mean, there is a lot of guessing involved because it's the future. So that's why I do think our knowledge of what has worked and what hasn't is so important, because we do know what actually happened, whereas there is so much guesswork. You know, I mean, a lot of the numbers, you know, I didn't use a lot of numbers in my talk, but to be honest with you, I can cite as many CBO numbers that are a lot more favorable about the healthcare bill. I mean, the most recent I saw on the Medicare bill is that, you know, the healthcare bill had extended the life of Medicare for almost a decade. I think it was 8 years. So, you know, I think that that's super important. You're sitting here, you're this policy student, you're like, come on, help me out. You know, this is why we need people like you getting the training you're getting. So that's good. But I just wanted to respond to one thing Josh said before. A lot of times I hear this comparison to auto insurance. And it frustrates me because, not to be divisive or anything, but I just had to flag the auto insurance thing. When a car is totaled, we throw it out. We're done with it. When my grandmother, who's in the hospital right now, a few days ago, we were worried she might be darn near totaled. But she's getting better now because, you know, we're there providing the absolute best health care in the world for her. And Emory Hospital is amazing. And we're going to make sure that the resources are there to make sure that we don't throw her out, you know, until God decides it's time for her to pass on. So that the comparison just always gets me going a little bit, because I think that it's different. And I think that preventive care for families and for human beings is different than an oil change.
And I don't disagree. I know it's just important to say. It's just important to say. I'm not saying that it's the same. My point was simply to say that we use health insurance for a lot more low-cost things that are more routine, whereas auto insurance, or, you know, frankly, life insurance for that matter, is something that is not for a routine expense. That's all I was trying to say with regard to medical trend as it relates to the pricing of risk, which is an insurance thing.
Right. It's just in those routine checkups, that's when you often, you know, identify major problems that can cost a lot more later. So humans are different.
Great. Another question, please, sir.
I used to live in upstate New York, and you're right that people in New York used to go up to Canada and get their medications because it's cheaper.
Right.
But what's not often mentioned is that a lot of people in Canada come to the U.S. for health care because
right.
health care in Canada is, by their perception, horrible. And
long lines, long waits, yeah.
Yeah, people die while they're waiting for services. Right. And like you wanting help for your grandmother, I think a lot of the resistance to this health care bill is that people have a concern that the quality of health care is going to decrease in America.
Right.
And everyone wants high quality care. So what assurances can you give that the changes in this bill are going to actually improve health care for people rather than decrease for everyone?
That's how the health care bill is designed. And if it doesn't deliver on that, I'm going to be first in line to hold our leaders accountable. And look, it's not perfect. We're going to need fixes along the way. You know, all of this is projections. There have only been a few provisions of the bill, some good ones around pre-existing conditions, around this, you know, under 26 provision that a lot of people have felt in their lives, some small business tax credits, closing the so-called donut hole for seniors around prescription drug coverage. But on those big deal cost reduction but maintaining quality issues, 2014 is when all this stuff really starts to kick in. And the theory behind this, you know, based on what we've seen work and learning lessons of what doesn't work too in other countries, you know, that's what it's based on. You know, if we're all covered, then we're all going to ultimately benefit. But we have to hold this thing accountable to that. It's not going to just happen.
On the issue of Medicare and it extending the solvency of Medicare, that is what the Congressional Budget Office, or that is what the actuary of the Medicare program has said. It will go to 2024. It's important. The actuary has also noted that that is essentially an accounting gimmick because it double counts the savings from Medicare as both being cut, $530 billion cut from Medicare, and so it is spent on new programs. And the actuary has said it can't both be, and the Congressional Budget Office Director, Doug Elmendorf, has said it can't both be spent and saved at the same time. So I think the most realistic assumption is that the Medicare cuts are not plausible because the actuary has said that if you eventually cut Medicare as it's projected in the out years under the law, then Medicare reimbursement rates will look like Medicaid, and I think that will create access. And they said it can even jeopardize care for seniors. So that's just important. It does, on the one hand, look like it's extending the solvency, but it's actually being spent on new programs. I'm concerned about quality. I think if you look at Massachusetts, they had a state-based kind of expansion, and they didn't have enough doctors to see everyone, so they had waiting lines. Their ER utilization went up dramatically. Medicaid patients are actually the most often users of the emergency room, and that's not anecdotal from my brother, who's an ER doc. That's proven on CDC studies. Another reason I'm concerned is that there in the law is something called the Independent Payment Advisory Board, which sounds really benign, but the Congressional Research Service has said that the president can actually recess appoint people to serve on that who are not elected and not necessarily accountable politically, and bypass the will of Congress to serve on that board. And all they can do is cut payments to providers. They can't change any of the cost sharing in Medicare, which would be the common sense place to go. And if you just cut payments to providers, providers are not going to see Medicare seniors. So I'm concerned about that. Like, here's one thing we should be doing. Katie and I can agree on this. There are 60,000 people on Medicare, currently on Medicare, who have income at more than $1 million. I think we should charge them more. I think when a program is going broke and they make $1 million, not net assets but income, I think we should charge them more for Medicare. You talk with physicians and ask them what they think about the bill. 2/3 of the physicians that we surveyed said that they think it's going to make quality worse. There's 2,000 times in the bill, almost 2,000, it's about 1,700, that the Secretary of Health and Human Services has given new controls and authorities, and I think it's hard for all that to come out right. It's easier for it to go wrong than right.
Did you want to ask the question? No? Okay. Well, I think we should stop. It's 1:05, and I'd like to thank our speakers, and thanks to you for coming.